Here in the studio, it is Dr. Michelle Hackin. Now, she is a clinical psychologist and she specialises in autism in children and young people. So I guess the first question is, what's the difference between a psychiatrist and a psychologist? Are you asked that all the time?
Yeah, start with the hard questions there, Gareth. Yeah, so a psychiatrist is someone who does medical training like every doctor, but then they choose to specialise at the end of that into matters of the mind. So they can prescribe medication, diagnose, that sort of thing. Whereas a psychologist is more therapeutic, I guess.
But you're still, as the title says, you're still a doctor, aren't you?
Yeah, so you have to do a degree first of all at university, and then you get experience for many years, and then eventually work your way towards doing a doctorate in clinical psychology.
And why did you decide to do this? Because I'll be honest with you, I like to read a lot about this kind of field, and I love to watch videos on YouTube, which you'll probably say, don't be doing that, because the majority of it will be from people who've got no qualification whatsoever in it. But I think it's really interesting to the point where how people move, how people look, and the kind of eye contact they make, it's all to do with the brain, isn't it?
Yeah, it's really interesting. And I think just before we came on air, you were talking about sort of God-given talents and how you sort of got into broadcasting. And I feel like it's similar with psychology and myself. You know, it just feels like this is what I'm meant to do.
And do you examine people when they don't want to be examined? In the case that, like, you came in here and you're now almost thinking in your mind, well, he's clearly got something there that we need to investigate. And because I think when you mention that you're a doctor of the mind, and people automatically start to change how they move and how they sit in a chair.
Yeah, definitely. But I think my job is so intense that when I'm off the clock, I'm not analysing people. I'm just letting people exist.
But it must be difficult to actually switch off because you're sort of still thinking, oh, that's an interesting trait.
Yeah, it is difficult to switch off. And I think if you've got your own children as well, it's very difficult because you're constantly sort of wanting to adjust your parenting, to make sure that everything runs exactly smoothly because you know how it should be done. But it's really difficult to do when it's your own children.
And why did you want to specialise in working with young children and young people?
I think it was just a natural progression for me. So when you do your doctorate, you try lots of different specialisms. But I think right from an early age, I knew that I wanted to work with children and young people. I just think it's so refreshing. They're so honest. It brings such joy and fun to your life. Plus, you can really make a difference because you are supporting people at a preventative stage in their life. So if they've got bad things going on, you can really get in there and make a difference, which I really like.
And did you decide to study autism because you've got maybe experiences personally, like family members, and you thought, actually, that's a really interesting aspect of the medical profession that I work in?
I think I've always been around autistic people, and in fact, I think I'm probably neurodivergent myself, although undiagnosed, but I just love it. It's just an area of work. As soon as I started working with autistic children and young people, I just knew that this is what I wanted to do, and it's been my passion ever since, and I'll learn and read about it all the time, even when I'm not working. I love to talk about it. So,
stupid question alert. So you said that you think that you may be neurodiverse. Is that the right phrase I'm using here?
So the language changes all the time, especially within sort of psychological frameworks, but the phrase that people are generally using at the moment is neurodivergent, which it doesn't mean autistic. It means any kind of neurodiversity within brain processing. So it could be ADHD, could be brain injury, lots of dyslexia, lots of different things.
So you mentioned that you haven't been diagnosed. Could you not diagnose yourself?
No, I think it would definitely have to come from someone else. But I'm kind of happy just, I guess accepting myself as I am. But for some people it can be really validating to actually have an assessment and receive a diagnosis so that they can understand themselves better and really feel like they can get to know themselves and understand their behaviour and their interests. And
so if you've got any questions for Dr. Michelle, then send them through right now. She'll be with us. Well, I haven't asked, actually. How long are you with us for? How long have you got?
I'll take your guidance on that.
Okay. So she's here till 5 p.m, ladies and gentlemen. The number to get in touch with us is 0161 511 9555. And maybe it's questions about autism. Maybe it's questions about other things to do with the mind. I mean, are we allowed to branch out?
Yeah, sure. I guess autism's just my special interest, but we get trained in all sorts of different areas, so yeah. Plus, there might be some people out there who want to be a psychologist, who want to think about how you get into it and so on.
We could literally be here until 5 o'clock if we branch out onto different angles. But do send your questions over. It would be lovely to hear from you. 0161 511 9555. Now, you know, literally, your questions can be as basic or as complicated as you like. I mean, at the end of the day, I don't have to answer them. I'll just ask them. But we are joined here by Dr. Michelle Hacking, who is a clinical psychologist, but she specialises in autism in children and young people. So thank you for your questions. And the first one here is, why do you see children with autism wearing headphones? Why is that, Michelle?
Why do I see them
Well,
wearing?
no, I mean, not just you. So sometimes when there's crowded spaces, you see young children, sometimes adults as well, and they wear, I don't think they're actually hearing music, are they?
No, it's
I think
ear
it's
defenders.
Ear defenders.
Yes.
So this question in from Erica, she says, why is that? How does it help?
Yeah, so autistic children generally will have sensory processing difficulties as well, and one of the consequences of that might be that very loud, noisy, busy environments can just overload the system and completely sort of overwhelm the young person or the child or the adult. So ear defenders kind of limit the amount of noise that they're getting from the environment to make it more manageable. So, and you'll see a lot of adults or teenagers perhaps wearing one earphone in, just having gentle music playing, just to kind of reduce the sensory input from the environment.
And thank you for these questions. They are great. You can get in touch with us, studio@connectradio.com if you'd like to, or the WhatsApp number 0161 511 9555. And this comes in from Kevin, and he said, can you ask Michelle, please? Actually, Kevin, it's Dr. Michelle to you. Can you please ask her, is there different levels of autism? Because there's, I guess what he's trying to get at, that if you watch a film like Rain Man, for example, clearly a person who's, would you say, severely autistic, and then there's other people who you would say aren't quite so autistic. And I am treading really carefully here because I'm out of my depth and I don't want to offend anybody. So if I do say things that aren't right, then please pick me up on it.
Yeah, so I think in the past, the language has reflected a sort of continuance, perhaps, where it's been from sort of mild to severe or high functioning. That's not the language we use anymore at all, because what we understand about autism is actually it's a bit more like a pick and mix. So you might have a person who has lots of sensory difficulties but can communicate really well socially, or you might have somebody who really, really struggles with social anxiety, struggles to communicate or to use spoken language, but is not as overwhelmed by sensory input. So it's more, they call it a spectrum, but it's kind of accepting that every individual who is autistic is different and unique and has a different combination of strengths and difficulties.
Now, here's an interesting question, and I should have asked this at the start, really. What is autism?
Oh, okay. That's a really good question.
That came in from Karen.
Yeah, that's a really good question. So the diagnostic criteria for autism, so when we are diagnosing, we have like a bit like a Bible, I guess, in terms of all the different criteria when you're looking through. So autism is a combination of social communication difficulties, social interaction, sensory processing needs, and also thinking about flexibility of thought. So for some young people, some autistic young people might not necessarily be able to understand what other people are thinking or to think about another person's perspective. So it might be quite difficult to deal with change, to deal with routines being moved around and that sort of thing. So it's kind of a combination of lots of different things, but it just means that the brain processes information slightly differently to what we'd call neurotypical people.
And have you found, since you qualified, so actually you're basically my exact age.
Yes.
Because, well, we used to go to school together, didn't we?
Yeah, and we just kind of met again by chance, didn't we?
Very funny. So it was going off topic completely here, but we got in touch again at my auntie and uncle's wedding anniversary party, and it was like, I remember you, and I remember you. And then we got talking, and I've been pestering you to come on the show ever since, because I love this kind of chat, just educating us and having an opportunity to ask questions to a person who's, you know, highly educated in this, and she knows what she's doing. So since you qualified, how has it changed? How has the landscape changed, both for maybe treatment and diagnosis?
Yeah, I think things are changing all the time, and I think one of the great things at the moment is sort of, I guess, neurodivergent movement where people are self-propelling the system, I guess, and really lots of adults who perhaps have never been diagnosed coming forward, receiving assessments, talking about that and sharing their information and knowledge and expertise around their own lives and their own experiences. So things, I feel, are really starting to shift to being more led by the people rather than the medical profession, and I think that's how it should be. There's still a long way to go, but that is changing over time, and I guess there's a lot more children that are diagnosed with autism, ADHD, and I think that's generally because there's more knowledge around it and experienced teachers are going to notice it more because they've perhaps received training, parents are more up on it. So yeah, lots of change.
Because just me talking from my memories at school, when I mean, nowadays you would say ADHD, but a while ago, they used to just be classed as naughty children.
Yeah.
It was almost a thing of, right, you know, there's the naughty kid, put them in the corner, they can play with their action men or the Barbie dolls and leave them over there while the rest of us actually learn properly. And it's changed, hasn't it, so much?
Yeah, it has changed, but there's still a long way to go. I mean, within our education system, it's an uphill battle for lots of parents because even if your child does have a diagnosis of autism or ADHD or dyslexia, trying to fight to get the correct adjustments within the school environment can be really difficult because schools just don't have the funding, they don't have the training, they don't have the additional staff. So it's very, very challenging for parents of children and young people with any sort of additional support need.
I was just about to ask, actually, about how it can affect the families as well, because a friend of ours, one of his children, struggled for such a long time with the education system because the teachers just didn't understand. And, you know, they would put this child in situations which would make him absolutely just fall apart. And then because of his actions, they'd be, oh, right, naughty child, he needs to be told off and that kind of thing. And thankfully now, they're in a completely different situation where the child is in a school that understands him, and it's been an absolute game changer.
Yeah, absolutely. Education is such an important part of this puzzle of getting it right for children and young people. And, you know, it's such a challenge for families sometimes. And I think if you can get a good school and you can get a school where staff are educated about supporting children with additional support needs, then that's great. But for a lot of children and young people, they're not receiving that. And, it, you know, it can have devastating effects, really.
And I know you could probably talk ages about this kind of thing because there's going to be so much of it out there. But if there are parents who suspect that their child is autistic or maybe ADHD, what's the first steps that they do? How do they get treatment and diagnosis?
So first of all, I guess it's speaking to perhaps your health visitor or school nurse just to, run it by someone, talk over your concerns and your fears, which can be really, really helpful, or perhaps your child's school teacher. And then after that, it would be a case of going to your GP, and depending on the area where you live, it's always different processes. But so, for example, in Manchester, you would go through, they have like a social communication pathway, so you can do that. So I guess you'd go to your GP first and discuss your concerns and get a referral either to a paediatrician or to the social communication pathway.
And we won't keep you too long, so we'll have you on till 9 o'clock. But, we would love to have you on again because there's so much to talk about here, and there's questions coming in which haven't really got much to do with autism, but have things to do with other things, such as depression, anxiety, and that kind of stuff. So maybe we can touch on that on another time.
Yeah, sure.
But a message in from B. And they say, is there a brain scan that could be taken which would show if a person is autistic or not?
Oh, that's a really interesting question, B. And I actually don't know the answer. The brain science behind this is developing all the time. And I guess in the future, we're hopeful that there might be something like that'll be able to make it easier for people to get a diagnosis or to understand how their brain works a little bit better. We know that there is differences in the brain for neurodivergent people, but it's still developing, and so at the moment the answer is no, unfortunately.
Where do you think it will be? So it's probably moving so quickly, isn't it? I mean, since you qualified, I bet you can see a massive amount of research that's been going on and treatment. Where do you think it will be in maybe even 5 years?
I don't know. I think I would like it to be more person-centred and person-led, because I think one of the campaigns in the media at the moment, or certainly on Twitter, is around autistic people being given the opportunity to influence research, to be part of research, so not have these kind of distanced experts kind of dictating the landscape of autism, but for it actually to be led by people who get it and who experience it every day. So that's what I would hope would happen within the next 5 years.
Well, if you'd like to find out more about Dr. Michelle, it's Kingfisher Psychology, isn't it?
Yeah.
So that's your company?
Yes.
Is it a company? Is it a clinic? What do you even call it?
So,
Your clinic.
I guess I started the business in 2021 because I guess I wanted to be able to help people in the way that I felt was research-led and person-centred. So, I set up my own business. I still work for the NHS 3 days a week, but sort of in my spare time, quote-unquote. I do have my own business, and part of that is therapy and assessment, but part of it is also education. So I am commissioned to do training for organisations. I go out and do teaching. So there's lots of different ways of influencing the system, I guess.
And when you I don't expect you to name clients, of course, that would be silly, but I always imagine that a friend of mine is a medical doctor, and he always says that he really enjoys it, and it makes him exciting when somebody comes into him with a condition that they've never had before, or he's never experienced it before, and he has to sort of really start doing research. Is that the case for you? It's almost like, oh, this is a juicy case.
No, I think that I think a lot of psychologists, we find our niche, we find our area that we really, really enjoy and that we're really, really invested in. And I think that, so when I get new clients come through, I suppose I tend to be thinking, am I a good fit for this person? Do I have the knowledge and experience to support this person? If not, I'll find them someone else who's better suited. So I think it's just finding a good connection and being able to run with that, really.
Well, it's been really great to have you on,
Thank you.
Maybe we can have you on again soon.
Yeah,
that would be great, because we've got so much to talk about still, and there's questions coming in, which, as I say, in fact, we've got, how long have we got? We've got a minute, right, okay, we've got a minute and 40, and I want to get through as many of your questions as we possibly can, but we won't be able to go through them all, but first come, first served. A message in here, let me find it, from Stuart, and he said, a question for Dr. Michelle. What are your thoughts on relationships between neurodiverse people and neurotypical? Can they work?
Oh, that's an interesting question, Stuart. You know, I think every individual is different, and equally every relationship is different. So I think it's just about working together and understanding each other's ways of being, I guess. So I think it really does depend on each individual relationship.
And here, one final one. Okay. A quick question here from Matt, who's been in touch, and he said, what are Dr. Michelle's thoughts on what should be done to help autistic children to remain in mainstream school?
I think that's probably more than would take in a minute, but yeah, I think it's just about getting that individualised support. So really digging down to each young person. What is it that motivates them? What are their strengths? How can we maximise their strengths? And what support do they need? So it's really about connecting with each individual, taking advice from family, taking advice from the young person, really involving them in the decision making. And yeah, so working really hard to make sure that it's an individualised package.
Well, Dr. Michelle there, thank you very much, from Kingfisher Psychology, and we'll have her on again soon. Thank you very much for your questions, and thank you, Michelle, as well.
Thank you, my pleasure.